Hello there. Thanks for joining us on the program Health Blog. My name is Nkechi Abok. Today on our table is the topic women's reproductive and hormonal health, which is essential to their overall well-being. And it is said that about 80% of women experience hormonal imbalance, leading to conditions like endometriosis and menopause-related symptoms. In Nigeria, 1 in every 10 women suffer from endometriosis, a condition frequently undiagnosed for years. I'm glad to have you join us on the program. With me is still Dr. Patrick Eze, the CMD of Silver Cross Hospital. We'll meet him after the short break. Stay tuned. Non-communicable diseases, NCDs, such as heart diseases, diabetes, and cancer now account for about 70% of all global deaths, with 80% of these deaths occurring in low and middle income countries. Welcome to Health Blog, where knowledge meets action. I might come down with malaria. I have to wait until you're having one headache.
So as it's suppressing it, the organisms are multiplying.
In every episode of this program, we'll bring you insights from doctors, specialists, and experts who break down what really matters for your body, your mind, and overall well-being. From everyday simple wellness tips to life-saving health insights, Health Blog equips you with the knowledge and tools you need to stay healthier, happier, and smarter. My name is Nkechi Abok. Join me on every episode of Health Blog, only on University TV Africa. Yes, Dr. Patrick, it's good to have you on the program again.
It's always a pleasure. Thank you very much.
You're welcome.
All right.
Let's go straight to women's reproductive health and the hormonal issues surrounding women.
Yeah.
What exactly would you say this hormone we've been hearing? What exactly, how best can you break down this thing called hormone?
So usually women have a plethora of hormones that govern the entire biology. And it creates a kind of push and pull effect on the entire biological system, almost similar to the way the moon rises and sets. It becomes a full moon and it goes through those phases, the circadian rhythm and all that. It's all biologic, governed by hormones. What are the common hormones that women have? You have estrogen, you have progesterone, you have oxytocin, you have prolactin, you have follicle stimulating hormone, you have, so you have a plethora of hormones that come to play in a woman's biology every month. So,
what are the most common ones now?
So the most common ones are estrogen, progesterone, and prolactin.
Okay.
Those are the common ones, that women go through.
So what do they do for us first?
Good. So that is even the main, that's why that brings us to the core of what we call hormonal imbalance. Okay. So every month, a woman goes through a cycle. The cycle starts at the beginning of her menstrual cycle. So she sees her flow. Now, for her to see that flow, there are certain hormones that are in higher levels than others for that to happen. So usually estrogen is the bleeding hormone. So if you check a woman during her menstrual flow, she has higher levels of estrogen, than progesterone. If she gets pregnant, the progesterone levels begin to rise.
What does progesterone do?
So progesterone,
you have told us that estrogen does for the menstrual cycle. Okay.
So progesterone is the hormone of pregnancy, essentially.
Okay, good.
Yeah, it's the hormone of pregnancy. So if you don't see your menstrual flow, then progesterone levels begin to rise.
Oh, okay.
If you see it, then the estrogen levels are the ones that are higher. So because there's a pull and push effect, sometimes external stimuli can cause a woman's body to be out of balance. Also, these hormones are produced in certain parts of the woman's body, from the ovaries and other sensitive parts of the body. So if the levels of this production for one or two reasons are compromised, then the levels of those hormones become lower than normal. For instance, there is an illness called polycystic ovarian disease. So in polycystic ovarian disease, a woman's ovaries are do not mature the way a normal woman would. So she has a lot of tiny ovaries that are immature and frozen. The ovaries in such women are not as healthy as we would like. So because they have very mature ovarian follicles, they don't produce enough.
Is there anything responsible to
Yeah.
that?
So
Responsible for that?
yeah. So for instance, genetics contributes, and then other things, diabetes mellitus, and all that can also induce. Can also come with PCOS. So when they have that, their levels of their estrogen levels are very low. So because of that, you can see such women go 2, 3, 4 months, no menstrual flow, because estrogen levels are low. So that's an example, a typical example of hormonal imbalance.
Yeah.
So the hormones required for menstruation are so low that the woman doesn't menstruate.
And that affects fertility?
Yes, it affects her cycle, affects her fertility, because if she doesn't menstruate, then ovulation becomes a problem, and then if she doesn't ovulate, she cannot get pregnant and all that. So you have that problem also. Then also, most of the time, when the progesterone levels are low, when the estrogen levels are low, the progesterone levels start going up. It's like a swing, So usually with such people, they now have these issues with fertility. They have issues with managing themselves as a result of understanding the nature of what they actually are expecting at the end of the month becomes a problem for them. So essentially what we say is, if you notice that you're beginning to have the telltale signs, which is one, absent menstrual flow, you're not conceiving as often as you would like, then you need to go and check to be sure. There are also more advanced illnesses like endometriosis that can also contribute to hormonal imbalance. But with endometriosis, what happens is that you have abnormal uterine tissue in other parts of the body outside the uterus. So that can be very devastating for such women. So let me explain what I mean. We have seen women with endometriosis in the brain, in the lungs. Now, because it's uterine tissue that is in those places, what happens is that when it's time for this woman to menstruate, she starts bleeding in those places.
Oh.
Yes. She starts bleeding in her lungs, starts bleeding in her brain, or in her intestines, or her abdomen. So we've seen that. So because of that, such women are so afraid of seeing their menstrual flow that they will only want to see it if they're interested in conceiving. Yeah, they'll come to you and say, "Doctor, block out my entire system."
How prevalent is this?
It is quite
bleeding
common.
in the brain.
Yeah, so the brain is rare, but it could be in any other part of the body. So if it's in your lungs, the woman will be coughing out blood.
And they'll think it's cancer or something, and they will now misdiagnose.
Yeah. Or it could be in the abdomen, and then she starts having extreme abdominal pain because she's bleeding in areas where she shouldn't be bleeding. So all these issues are issues that could come with, that could lead to hormonal imbalance and cause women to have a lot of issues with their fertility.
Okay. So are you saying every woman will go through this hormonal imbalance?
Yeah, so sometimes it's not that in the lifetime of women, there are times that they will experience some form of hormonal imbalance. Sometimes it could be from external factors, stress in the environment, strain of work. Then for women who are athletes also, because they have to work out a lot, so testosterone levels become high, and then the other hormones become relegated and all that. So physical activity, starvation, weight loss, all those things. Yeah, there's a hormone called leptin. If you lose enough of it, it starts affecting all the other hormones.
How do we know that? How do I know that I'm losing leptin?
Yeah. No, so usually it's your body activates, like for a woman to usually start menstruating, she has to hit a particular body mass index. And it's because a hormone is regulating that. And when the body now notices that she's at this age and size and all that, then it says, okay, she's good to menstruate. So it's the biological system of a woman is really, really interesting and complex.
Okay.
Yeah.
So how do we know the difference? Because I know some are mild, we have some are very severe. So how would a woman know that this is a normal hormonal imbalance and this is abnormal? This is it even life-threatening?
Yeah, no, most of the time, if it may not be life-threatening, but it could disrupt your activities to the point where you're no longer comfortable because you don't understand what your cycles are like. So I have had patients who only see their menses once a year.
And they have children?
Okay, in this particular case, she was lucky. We had to induce her, and then she later conceived.
Oh.
You understand? But you see how difficult it is for you to, and there's nothing other than the hormonal problem that's wrong with her. Then also, one of the other issues that could come with hormonal imbalance is excessive bleeding. You could bleed excessively if one hormone is so high, persistently, that it prevents the other hormones from taking over, And so when that happens, you now have a situation whereby this woman bleeds excessively, and most of the time she has to be in and out of hospitals to manage the bleeding, So these are the things that could happen.
I also know of a case where a woman menstruates like 2 times in a month.
Yeah, so all these things are all signs of
okay.
hormonal imbalance and all that. You could also have hormonal imbalance even lasting into pregnancy. Where a woman gets pregnant, and then the hormones that are responsible to ensure that the baby matures is insufficient. And so the baby doesn't thrive. So usually you see sometimes some women will be having repeated miscarriages, especially early trimester ones. So you'll be wondering what's going on. And usually if you just supplement them with artificial hormones, they're good.
Okay, so let's look at how the woman's reproductive health issues affect hormonal imbalance.
Yeah. So the reproductive health issues that affect hormonal imbalance, you can look at it in 2 ways. One is that most women do not understand their reproductive health.
Okay.
In fact, most women never understand their anatomy. That's the truth. If you ask a woman, now, where is your cervix? They don't know where the cervix is or what's going on. So because of that bereft of knowledge that they don't have, it becomes a little difficult to really know when there's a problem, So usually we advise women to try and educate themselves. Another...
That's what you're doing right now.
Yes.
You're educating us, so please.
So another very close enough issue is like with breast cancer. You wonder why women come to, and it's also hormonal driven, why women come to the hospital with very advanced breast cancers, So you would think that they'll be able to check themselves often. Do you understand?
Yes.
But a woman will tell you, well, except when I take my bath. Do you understand?
God forbid.
So, and then all the God forbid things. Or she may even notice it and become, in denial, and all that. So because it's also hormonal driven, and these days it's genetically based. We could track the genes that can cause breast cancer. So if you have the resources, you could check. So if you have it, then so I remember Angelina Jolie had to do a double mastectomy. She removed her 2 breasts because she has the genetic predisposition. Not that she had breast cancer, but it's in her family.
Yes, and she's trying to prevent
herself. So that's one. Women, when it comes to women reproductive health, women don't really know enough to know when there's a problem, and even when they know, they seek solutions in places they shouldn't, So a woman can be having heavy bleeding, and instead of her to go to the hospital, she goes to a chemist, and then from there to herbal.
Mama.
Herbal, they start cooking things,
and
all that. And sometimes it's a fibroid that's causing it. Sometimes it's hormonal imbalance. And even doctors, we will not even be able to know until we do a scan to at least check, to be sure that this is what it is and this is what it's not.
Oh, okay. So we'll quickly go on a short break. When we come back, we'll talk about the effects of hormonal imbalance. What happens to women? A lot happens to women, I'm sure. We'll be right back. Please stay tuned. Non-communicable diseases, NCDs, such as heart diseases, diabetes, and cancer now accounts for about 70% of all global deaths, with 80% of these deaths occurring in low and middle-income countries. Welcome to Health Blog, where knowledge meets action. I might come down with malaria. I have to wait until you're having one headache. So
as it's suppressing it, the organisms are multiplying.
And every episode of this program will bring you insights from doctors, specialists, and experts who break down what really matters for your body, your mind, and overall well-being. From everyday simple wellness tips to life-saving health insights, Health Blog equips you with the knowledge and tools you need to stay healthier, happier, and smarter. My name is Nkechi Abok. Join me on every episode of Health Blog, only on University TV Africa. Thanks for staying tuned. You're still watching Health Blog, and we're talking about women's reproductive and hormonal health issues. Let's look at the effects of hormonal imbalance on women? How do they come out to be? How do they appear?
Yeah. So usually looking at a woman's appearance, you can never know if she has imbalance or
No.
not. And even as doctors, when women complain, we need to do further investigations to find out what kind of imbalance is she having. Is it even a hormonal imbalance? It could be other things. Sometimes it could even be a cancer, because if you have a cancer affecting where the certain hormones are produced, you could have a form of hormonal imbalance. Yeah, because the cancer will make the hormones, or that particular hormone, to be in larger quantities than is required. So sometimes you have pituitary tumors that can give rise to hormonal imbalance. So that's why it's always tricky. You need to be careful.
But one of the common ones we have is hair loss.
Yes.
In women.
Yeah.
And so.
Yeah. So, for instance, for certain hormones, let me see if I can go through them one after the other. Some women, even though they are not pregnant, produce breast milk.
Okay.
Yeah, and that is because of excess of a particular hormone we call prolactin. Now, if she has a tumor in the brain that affects that production we call prolactinoma, she can end up having excessive milk production. And when a woman's breast is producing milk, it deceives her body into thinking that there's a baby somewhere. Yeah. So that alone can make a woman infertile. So you see a lot of young ladies, they're having milk discharge or liquid discharge from their breasts, and they're having problems conceiving because of that fact. So that's what prolactin can do. It's usually high when a woman is breastfeeding. You see it in high levels, but for some single ladies, you could have it, or for some newly married women, and they have it and they have difficulty conceiving. The other things are, as I mentioned, when you have abnormal levels of estrogen and progesterone. If a woman is not seeing her menstrual flow regularly, infertility is knocking by the corner, because you cannot plan her cycle for her. You can advise her reproductively, because she's not, her cycle is out of balance. Yeah. So infertility becomes a problem, or subfertility as such. In the difference between infertility means you've never conceived. Subfertility means you have conceived, but you're still struggling. The other things that could also happen is that such women also have difficulty with social life. Hormones also tend to put women in some form of some hormones affect behavior.
Yes, our emotions.
Yeah, so for instance, women at menopause, hot flushes, outbursts, and all that are common with them, because a certain hormone is higher than the other one. So all these things are things that you begin to see in women, that affect them. So you have the social construct, you have the fertility construct, then you have the fact that they could even have cancers that are hiding behind the hormonal imbalance. And then lastly, when women are pregnant, if they do not have sufficient levels of the hormones that they need, the babies may not be able to thrive. So these are the plethora of things that could affect women.
But women, especially maybe like you said, after postpartum, there are lots of issues that happens. And how do you expect women to cope? Because women, we exude different emotions when this happens. Yeah. So what should a woman know at this time, and what should people around her help her? How should they help her to cope with this?
So when a woman is in postpartum period, it means she's delivered and she's recovering from the 9 months of pregnancy. So it's a challenging period for them.
It's very challenging. Most women don't even know, and there's something called postpartum depression, for instance.
So there is postpartum depression, there is a postpartum psychosis, and these are levels of mental problems that women can have because of pregnancy. So sometimes there are genetic predispositions, and then sometimes it is a woman's reaction. In fact, we've seen women who become so depressed they can't breastfeed. Some even start maltreating the baby. I've seen a case of a mother burning the baby's leg.
Wow.
Yes. Not that she really wants to do that, but she's not in the mental space, at that time to take care of the baby. or she's avoiding the baby. She doesn't want to breastfeed. Sometimes it's the trauma of going
it's the
through the
trauma,
9 months
actually.
of carrying the baby, and then maybe sometimes the feeling that this baby almost killed you to come
Making me lose my shape,
yeah,
my
so all those
everything.
things, yeah.
Yeah.
So a lot of women need a lot of counseling
Okay.
in the postpartum period, and that's why WHO also recognizes that a woman doesn't just deliver and then you pursue her. She has to keep coming to the hospital for another 6 weeks for follow-up, so that you're sure if there's certain things like that you can pick it, because it's very subtle. The woman can start from not eating well. Before you know it, she's disinterested in what is happening. Before you know it, she's not taking care of herself. She's not neat. She's not bathing the baby. Those are the telltale signs of things that have to do with postpartum. In the postpartum period, you might see that might be a red flag that there's a serious problem.
You're talking about women's issue. I don't think we can really exhaust this topic. Maybe we have to continue in the next step in another episode. But let's quickly look at what's nutritional factors that can help us balance and cope with a better reproductive health and hormonal.
Yeah, so we always advise women to try and stay within a weight bracket that's healthy for them. The reason is this: women, yes, usually are more concerned about how their bodies look, these days, and there is a drive to look a certain way. And then sometimes women taking drugs to reduce or stimulants or whatever to achieve those objectives. And sometimes those things have some repercussions. As I said, if a woman loses enough weight, she can throw her entire hormonal system out of balance.
Okay.
So you want to lose weight and you still want to be healthy. So usually we advise balanced diet. If you must lose weight, try and also do within ramifications that enable you to be healthy enough, to also cope with other activities, so that you don't put a strain on your body, because you want to achieve certain objectives. So we advise, try and ensure that you have a balanced diet. You mustn't eat heavily, but you could eat regularly and eat the right things. Make sure you have a lot of fruits. Make sure you have a lot of vitamins, that come with these fruits and all that you're taking regularly. Drink a lot of water and all that. Because the truth is that the hormones are like enzymes and they're made from these things that you eat. So if you're not eating well, the body doesn't have the store to manufacture those things that you need,
I don't know if you've talked to us about the signs a woman should look out for. How would I know that, okay, I'm having hormonal imbalance?
Yeah, so sometimes there are subtle signs and then sometimes they're very glaring. So one of them is what we'll call intermenstrual bleeding. So the menses is either in a month twice or 3 times. Then you could also have heavy bleeding for a long period of time. Then you can have absence of bleeding.
It's okay.
Amenorrhea. You're not pregnant and you're not seeing your menstrual flow. Then the other symptoms are if you have PCOS. Some women also have to be screened for diabetes because it comes with that. And then other things, facial hair and all that, are things that you want to look out for. You want to explore deeply.
Okay, so let's look at prevention. How do we prevent future episodes of?
So the truth is that with hormonal imbalance, prevention usually is more of the problem develops and they don't look for how to solve it.
Okay.
So
maybe coping mechanisms.
Yeah, the coping mechanism. So usually one is don't panic. Know that there's a solution to the problem. Visit your doctors. The team usually includes a medical officer, a gynecologist. They will look at you, do the relevant investigations, do a scan, HSG, check your entire reproductive system, find out where the issues are. And most of the time, I think we're pretty good at solving some of these problems. It's very rare to have, except maybe in the case of endometriosis. And even with endometriosis, the advancements these days, laparoscopic surgeries that we do to help, remove some of those issues without doing like an open surgery for it. And there are medications you can take and all that to help put your system back in balance and all that. So good health-seeking behavior for women is important. In the country currently, women go to hospitals more than men, which is good. But they, most of the time, visit hospitals more when they're pregnant and all that. So for a young lady, if she finds out that she's having these challenges, she should seek help early enough. And I always tell people, don't wait until you're too advanced or you want to have all the money before you now come to the hospital. It could be something that the earlier you come, the better for you.
So this one that is particular to me, like I'm more concerned, is the hair of a woman.
Yeah.
People say the hair is a woman's glory, right? So
yeah.
What is that thing that is responsible for hair loss? And if I'm losing my hair, for instance, what exactly should I do?
So, it's funny that hair is actually produced more because of testosterone. Mm-hmm. Yeah, and that's why men have more hair than women. Mm-hmm. So testosterone is the hormone that encourages hair growth. Mm-hmm. Okay. So women do not produce as much testosterone as men, but they do produce enough, So, but if their levels are now very low, then they start having alopecia, which is hair loss.
Men have that too?
Yeah, men have that, but usually at older ages when their own testosterone levels are dropping. Do you understand? It comes with old age, because their levels are now dropping, not as virile as they used to. So for men, the testosterones are produced by the sperm cells in the testes. Okay. But for the women, there's no testes. So it is the adrenal glands that produce testosterone, and it's not primarily the organ for testosterone production. She just produces a little. So usually, if women start having hair loss, they need to see the doctors. We'll now look for what to do. We check the hormonal levels.
Just come to you. Yeah, tell us what we can do. Is there anything? What habits should we, take up to help us produce more testosterone?
So because it's usually a hormonal thing, we need to investigate to find out why are your levels low. What can we do? How can we improve it? Is it really because of just the hormonal problem, or are there other issues that we need to investigate?
So proper diagnosis is very important.
Very important, because you can't guess it could be so many things. Then also women have the luxury of having artificial wigs that they can wear. So if a man has that problem, you can imagine what he's going to wear. But women are able to wear all kinds of, they have a lot of options.
That's for the glam.
Okay. But if you do have that problem, then you need to come so that we do like a thorough investigation. Okay. So usually, if you're older and you're having that problem, yes. But if you're young and you're having it, then you need to come. Okay.
So one last word for a woman out there.
All right.
Someone watching you that is going through postpartum, having hair loss. Yeah. What would you want her to do? What should we do? Does exercise even help in any of this?
Yeah. So anything that makes a woman feel better about herself, because usually, unlike we're biologic in the sense that these hormones that are like chemical neurotransmitters and chemical enzymes are able to affect us in ways that are really funny, because if a woman is depressed, she should check the levels of certain hormones in the body. You see that some of them are higher than others and all that. If she's not feeding well, she check. You see, there's some problem. So we always advise healthy living, eat balanced diet, exercise, listen to your body. A lot of women do not listen to their bodies. They always keep pushing the symptoms to the back or to the floor. And then at the end of the day, the problem can spiral into something more sinister. So if you notice that you're not, your body is changing in a certain way, please try and see the doctors.
Thank you very much for these insights.
All right.
The women's reproductive health is very important to their well-being. We've heard that we need to practice healthy lifestyle to help us navigate and cope with this issue. Thank you for joining us. My name is Nkechi Abok. See you next time.